To bear a child in third world countries is life-threatening. Every minute a woman dies caused by complications due to her pregnancy. Where women suffer from malnutrition and live under insufficient hygienic or medical conditions, the number of maternal deaths is even higher. Women and mothers play a central role in the development of families, although they are often being denied the adequate right of health care and inviolacy. Aside from poverty, inadequate hygienic conditions and exacerbated access to health care institutions, it is often the lack of education on health matters which are the main reasons for high infant mortality.
My name is Demokratia. I'm 13 years old and I live out of town in a small village. It was my first pregnancy. I was in pain for days, and because I could not deliver my baby alone, I walked to the town at 3 o'clock in the morning to look for a hospital. It took me 4 hours to find one. I started on foot, they operated on me, and now I have a small girl. But somebody has to take care of her.
Demokratia did not know at that point that her baby was stillborn. Very often the lack of education on health matters and inadequate health care are the main reasons for the high mortality of affected mothers and their babies. 8 to 20% of children are dying in their first year, and about the same percentage of women, 8 to 12%, die during or shortly after childbirth.
I'm 21 years old and I had 5 miscarriages because I did not know that this hospital exists. Now I know it and I have already delivered 3 healthy babies here.
Since real success is only possible by including the local opinion leaders, the project started to get in touch with the emirs of Kano and Kaduna state and other decision makers. But real help will only be possible by adapting an integrated approach which should include the following elements: broadly based education, effective healthcare provisions, training and instruction, clean drinking water with the inclusion of the local stakeholders and opinion leaders.
A similar way. And I'm hoping that perhaps early next year we shall have a stakeholders
approach, social and cultural. Why do you need that?
The challenge is to find the cost-effective interventions. We have to start with an advocacy and awareness campaign. We have to train the staff. We have to equip hospitals. We have to discuss it with the government. Sometimes you need even a road because mothers cannot get to the next hospital in time. We have to increase the skilled birth attendants. We have to convince the families, including the husbands, that it's best for the mother when she is pregnant to go for antenatal care to the next hospital. We have to see that there are emergency hospitals, referral hospitals. So it's a very, very complex matter.
While genital mutilations, early marriages and the tradition of house births constitute societal phenomena which can be slowly overcome only through a campaign of education, the problem of vagina fistulas is a wide-ranging medical problem. It could be, by and large, avoided, and it stigmatizes many women and drives them into isolation. These kinds of lesions develop when, through a prolonged birth process, the tissue in the birth canal dies and cannot be replenished by a healing process. Both the medical and the societal consequences of those kind of fistulas are catastrophic. Women are usually expelled from their families and/or communities because they lose their urine, their body odor becomes unpleasant, and therefore have to live a life at the fringes of an already poverty-stricken society.
We have more than 6,000 new cases of female vaginal fistulas per year and a home delivery rate of approximately more than 59%. This is the highest worldwide. Since the project of improvement of maternal mortality has been established, we implemented different activities for example, treatment and prevention of female vaginal fistulas, the planning and realization of new operation theaters. Further on, we bought equipment and trained doctors and nurses. We hope and believe that we are able to achieve the improvement of maternal mortality.
A core condition to improve the health of mothers is to give them access to family planning. In hospitals which cater to those projects, women receive the proper information both in terms of family planning and health care. They also receive recommendations catering to their needs. A particularly important aspect of the project is both to prevent the transfer of the HI virus from the pregnant woman to her baby and of malaria through distribution of mosquito nets. To lower the number of mothers who die at childbirth, it is necessary to train midwives accordingly, and in particular the so-called traditional birth attendants and the healthcare advisors. The goal must be to employ qualified and dependable midwives who detect in time a possible life-threatening condition for the mother or her baby and draw the respective conclusions. To improve the situation of those women who have undergone a successful operative treatment of the vagina fistulas, both a phase of rehabilitation and a program of reintegration after the surgery are obligatory. Women receive instruction in manual labor, microcredits, education in family planning and health care. All the accrued knowledge is being passed over to the other women in their community, which ensures sustainability and a remarkable effect of multiplying those trades.